Hi, and welcome to the first in our series on breast cancer awareness. We're celebrating, though that doesn't seem to be quite the appropriate word. We're educating on the important topic of breast cancer in our community. This is the first in the series of programs. Every night this week at 8 o'clock, we'll be featuring some new speaker on a very interesting topic, and we hope you'll join us every evening for this important topic. We're delighted to have you with us here tonight, and I'm equally delighted to have as my guests two rather important folks involved in breast cancer and other aspects of other kinds of cancer. They're with the American Cancer Society. First, I'll introduce Nicole Hensler. I'm delighted to have Nicole with us. Nicole is the Cancer Control Strategic Partnerships Manager, quite an august title, with the American Cancer Society Northeast Region. We also have Hillary Snyder, who's the Maine Government Relations Director for the American Cancer Society Cancer Action Network. So we are going to learn a range of things from these two very influential and women. So I'm delighted to have you with us tonight. Thank you. This is our first Zoom TV show, so Lordy knows we're learning as we go. So thank you so much for bearing with us. Let's start by talking just a little bit about what each of you, what your role with the American Cancer Society. Nicole, exactly what do you do?
So thank you for having us today. I am the Cancer Control Strategic Partnerships Manager for the American Cancer Society here in the state of Maine. I work with our health system partners in all the communities across the state, really looking at the entire continuum of cancer care, from prevention, early detection, all the way through survivorship, and ensuring that the American Cancer Society is there to offer services if needed, offer education if somebody is diagnosed with a new cancer, or offer information on timely cancer prevention screenings, and also information to be a myth buster for the HPV vaccination and when we work with our adolescent population.
That's quite a responsibility. How do you accomplish that? Through a network of volunteers, other employees? How do you achieve that broad range of responsibilities?
So in the Northeast region, there is a team of us doing this work all around the Northeast region within New England. And in the state of Maine, I actually have another colleague doing that. So we've really identified the systems that we'll work with, including health systems and FQA, federally qualified health centers, insurers, and really working with the Maine CDC. And we really listen to them to figure out what their priorities are and how we can best support them. So we really are more of a neutral convener in the state to really be that educator and partner to really bring scientific education to the forefront.
So a broad network of folks.
Correct.
Anyway, and Hillary, you are with the American Cancer Society Cancer Action Network. Sounds like and your title is the Maine Government Relations Director. So you're dealing directly with our state government. Is that correct?
Yes. So I work for the American Cancer Society Cancer Action Network, which is the nonprofit, nonpartisan advocacy affiliate of the American Cancer Society. And what I do for ACS CAN, which is what we are called by short, is I am I run our advocacy efforts in Maine. I oversee them. So that includes working with a network of volunteers from all across the state of individuals whose lives have been impacted by cancer to share their stories with lawmakers at the state level and at the federal level. So I work with them sharing their stories with lawmakers here in Augusta and in their districts. And then also when our congressional delegation is here in Maine, I work with our volunteers to meet with them so that our lawmakers can make sure that fighting cancer is a state and a national priority.
So your job is to keep it front and center, both state government and with our elected officials in Washington. Great.
Yeah.
Tough
So
job.
our role is to make sure that we're passing laws and policies that help prevent and reduce the burden of cancer.
Yes. Well, since our focus this month is on breast cancer awareness, let's talk a little bit about breast cancer. There's so much that goes on. I know had it said that even having breast cancer 10 years ago was a whole different experience than breast cancer today in terms of the advancements that have been made. Talk to us a little bit about some of the activities that are underway. Either one of you, I know I'm familiar with the Making Strides Walk, which I guess this year was done, virtually? I've participated in that for the last 10 years or so. But talk about some of the things that you all do around the issue of breast cancer.
Hillary, do you want to go first?
Sure, I can talk about advocacy and breast cancer. So, and just so you know, for me, this is not just a job. My life has been incredibly impacted, especially by breast cancer. My mother passed away from breast cancer when I was 12 years old.
Wow.
And I have many other family members and friends who've been impacted by breast cancer. So at the advocacy level, we do a lot around, especially right now, around at the federal level, around making sure that we're adequately funding and sustainably funding research. So the federal government is the #1 funder of cancer research. The American Cancer Society is the second, and the #1 non-governmental funder. But the National Institutes of Health and the National Cancer Institute, which is part of that, funds billions and millions of dollars of cancer research each year. So this year, actually, some of our volunteers from Maine and I met with our members of Congress in early September as part of our National Lobby Day. And we are asking Congress to support increased funding for cancer research and prevention programs. We're looking for a $3 billion increase in funding for the National Institutes of Health in 2021. And that includes an overall budget of $6.9 billion for cancer research at the National Cancer Institute, and also looking for them to support $559 million for the U.S. Centers for Disease Control and Prevention's cancer programs. So we're really making sure that the pipeline of research is kept sustainable, and that there's adequate funding. The impact of COVID-19 has been significant on cancer research federally, and many clinical trials have been put on hold. So we really need that extra boost of federal funding for cancer research to get those trials back on track, so that we're finding new cures or better ways to treat people with fewer side effects, and advancements in prevention and early detection. And then also to make sure that the cancer programs at the Centers for Disease Control are funded. And that includes the National Breast and Cervical Cancer Early Detection Program, which in Maine is called the Maine Breast and Cervical Cancer Program. And that program helps women who are uninsured or underinsured have access to breast cancer screening.
And how is that administered? Is it administered through the local hospitals, even though they are uninsured?
So it's administered through the Maine CDC. Each state gets amount of money from the US CDC that helps provide people with, so basically they have relationships with hospitals and healthcare providers, so that when someone who's uninsured or underinsured shows up and gets a mammogram, that the health system gets payment from the Maine CDC for that.
That's a wonderful program. Is that something that goes on nationwide, or is that unique to us?
Yes, no, that's a nationwide program. All 50 states have that program, and it is largely funded by the US CDC with some matching funds from the state, including in-kind funding from healthcare providers.
Now, did I understand correctly when you first started, do you all administer some research funds as well? Did I understand that correctly? The American Cancer Society, I mean.
Yes.
You do?
Yes.
Okay, and you're
We
the
do.
second only to the federal government. Wow.
Correct.
Now that's
Correct.
very impressive. Congratulations. So
Thank you.
all these fundraising events that go on around the state go to good purposes, well, all around the country, but in our state, we do a number. Wow,
Yes.
that's very impressive. I'm sure
So-
the number doesn't quite compare to the federal government research budget, but being second is being second. So
It's pretty impressive, Marla. It is since 1946, the American Cancer Society has funded $4.9 billion in research funding.
wow, wow.
Mhm.
Well, let's talk about some of these initiatives. Briefly mentioned Making Strides. I'm very familiar with the Real Men Wear Pink. We have a local business owner here in Newcastle that raised the most money last year on Real Men Wear Pink. It's quite an event. I've attended that each year as well. But talk about the range of fundraising activities you all have underway within the state.
Sure. Right now, it is our Making Strides Against Breast Cancer movement. So we have 3 events, and COVID-19 impacted our ability to gather in person in our communities as we have in the past. But we have not stopped our events and our opportunity to raise awareness and the much needed funds for our mission. So we have 3 events here, one right in Making Strides Against Breast Cancer in Damariscotta that thank you for participating in the past. And then we have our Making Strides Against Breast Cancer event in Brunswick, and then another one right down here in the greater Portland area. And instead of gathering together in person, we have offered a couple opportunities for our event participants to walk individually or with their teams, and continue to raise money to support the American Cancer Society's mission. We have an opportunity to gather together to do a Pinkie Ride car parade. So what that is teams will register. You need a ticket. And you just decorate your car as pink as you would like, and do about 1 mile to 1.5 miles, depending on where you are in the state, parade right down to help increase awareness around breast cancer education and awareness month. And then another opportunity, which you've mentioned, is the Real Men Wear Pink campaign. And what we have done for that's been here in existence here in the state for a few years, and we identify male ambassadors in our communities to be that voice to raise awareness, because it's not just a female disease. Men are diagnosed with breast cancer, and we actually have a candidate this year who is a breast cancer survivor. So he is really working hard to increase awareness for his networks as well.
Wow. So what does the future hold? I've heard it said that not that many years ago, a diagnosis of breast cancer was a guaranteed mastectomy. That has changed. So to talk about the advances that we've made and what you are hoping for in the future. What looks promising on the horizon for this awful disease?
Hillary, do you want me to go? Okay, so treatment has come a long way, as you've mentioned, and research is so important to really decreasing the impact and the burden of this disease. So we have a funded American Cancer Society researcher in the Boston area right now looking at opportunities around new modalities for treatment. So I think that there's a lot to be understood because cancer affects everybody differently. So there's not really one opportunity to rid this disease for all individuals, because it is a different makeup in our body. So if we can continue to fund research and continue to find scientific facts and evidence-based information on decreasing the impact and the burden of cancer, then we're making some pretty amazing progress.
Yeah, and I would just add, so as Nicole talks about, and as we've talked about, There's a lot of work that's done in labs and in hospitals and clinical trials across the country and here in Maine. But the other way, as I've mentioned, that we advance outcomes is through advocacy and our efforts there. And what we like to say is it's not just in the labs, but it's also in the halls of the state houses and in Congress. And actually, many people's ability to access healthcare coverage is through their state and federal laws and policies. And so one of the areas where we've seen incredible advancement in cancer treatment is many more cancer medicines are delivered through pill form in oral, what we call oral chemotherapy. And those treatments are often more targeted, can come with fewer side effects. So we not only see women who are diagnosed with breast cancer live longer, but we also and have better prognosis, but we also see them have fewer side effects many times when they're going through treatment, which means that they're able to keep their jobs and also don't have to travel far distances, which is incredibly important in the more rural parts of our state to get IV chemotherapy. And also, as I said, experience fewer side effects. And so one of the things we've done here in Maine about 5 years ago was we passed a law, our volunteers and myself helped pass a law in Maine to provide equal access to oral chemotherapy. So that what happened when those drugs first came out is that people were paying incredibly high out-of-pocket costs. So they could cost up to $500 a month or more for your prescription drug copay or your out-of-pocket cost. And we passed a law that said that insurers had to cover that oral chemotherapy at the same level of IV chemotherapy with the same out-of-pocket costs. And pretty much when that law went into effect, overnight, patients across Maine who were taking oral chemotherapy saw their out-of-pocket costs dramatically decline.
Wow. How is the decision made whether one has traditional chemotherapy or the oral variety? Is age a factor? What are the factors that go into deciding just which course of treatment is chosen? Well, I know you're not an oncologist, I know that.
Yeah. People make those decisions with their healthcare team. And there are some, cancer is not just one disease, it's hundreds, if not thousands of diseases. And that one of the things that we're seeing with cancer research advancements is that really can be the genomic or the composition of that cancer that determines what treatment may be the best outcome for you. So it's becoming much more of an individualized treatment regimen for many cancers, and that is again a decision that's made between the patient and their clinical healthcare team.
That's right. You mentioned that one important factor, genomic testing, that's started to play a much more important role in the process, determining your rate of recurrence and so on. So how are our rates of breast cancer in the state of Maine? What are our rates in Maine, and how do we compare nationally?
Hillary, do you have that data right in front of you?
I don't have it right in front of me, but I can pull it out.
The access to screening right now is widespread throughout the state, but I will say there is concern nationally for the impact of COVID-19 on cancer screening. So back in March, when we all went into quarantine and for the pandemic, there was a significant amount of cancer screenings that were delayed. And the modeling is showing now that the diagnostics for breast cancer is down 87% for mammograms across the country. So
wow.
That is significant. And there is concern in the oncology field that there will be an increase of new diagnoses of many cancers because of these missed screenings. And I know that our partners are working at getting folks back in to get screened to make up for those missed screenings. So so it is, they're working hard, our partners, to get their patients and decrease that fear of coming back in for their diagnostic mammograms.
Yeah, yeah. I just always had heard that our rates were a little higher in Maine than nationally. I don't know if that's correct. I'm repeating something I heard, so that was why I asked the question. And Hillary, go ahead.
Yeah, so in Maine this year, it's anticipated that over 8,000 Mainers will be diagnosed with cancer, with some form of cancer, and that around 3,000 will die from the disease.
Wow.
And so breast cancer makes up around 1,370 Maine women are expected to be diagnosed with breast cancer in 2020, with about a little bit under 200 expected to die of breast cancer. And while our overall cancer incidence rate in Maine is higher than the national average, our breast cancer rates are actually right around the national average. And a lot of that is due to, we have, as Nicole said, really fantastic screening rates for most preventable cancers. Where you see a lot of the impact in Maine around our higher than national average cancer rates are tobacco-related cancers. And that's due to our higher than national average rates of tobacco use.
Wow, 200 deaths. That's shocking. I guess that would be advanced stage when the diagnosis comes. Yeah. Wow. Anyway, well, this has been remarkably informative.
Yeah, and we do see a lot of disparities in that, Black women have a higher breast cancer at higher rates than white women. So we see things with regards to that can have to do with socioeconomic status, but it also can just have to do with genetics and also institutional racism as well. So, and there are other disparities as well with lower women who are lower income tend to have higher rates of breast cancer. So in some cases, while you're seeing some of those deaths may be related to later stage diagnoses or metastatic breast cancer, they can also be due to people not having access to health coverage at all, or possibly not having great options for treatment because they feel like they can't afford treatment. We're fortunate in the state and across the nation to have many healthcare providers and hospitals who will treat people no matter what their insurance status is. But you do see barriers related to all sorts of different barriers, including transportation, but also the ability to have a healthcare provider.
Yeah, I've seen that in friends. I know someone who received the same extraordinary care at the breast care center in Scarborough and she was uninsured, that another friend had who was insured. I think we're to be commended for that. Of the 1,300 plus cases we have in Maine, how many of those are men? How does the rate for breast cancer compare between men and women? Do you all know?
Go ahead, Hillary.
I don't know I don't have the numbers for men. I imagine that they're very small. It is very rare. As Nicole said, we do have volunteers who are male breast cancer survivors, but it is incredibly rare, especially if you, actually one of our lead volunteers for ACS CAN is a male breast cancer survivor, and he has no family history. He has had genetic testing and has no genetic markers for breast cancer. So his case and he was diagnosed very young, very active, healthy athlete, incredibly rare for that to happen.
Wow. And what is the age you all recommend that women start receiving mammograms? Is there a recommendation that comes from the ACS?
Yes. So we recommend that women begin conversations with their healthcare providers at age 40 to really identify their risk and talk about breast cancer screening and their family history. So between age 40 and 44, really having that shared decision-making conversation. We had changed our recommendations years ago to initiate mammograms at age 45, but really have those conversations and consider with your healthcare provider if you initiate screening earlier based on your family history.
Yeah, and that plays an important role because we all know instances where women were under the age of 40 and were diagnosed. This has been so helpful. Is there anything important that we've missed talking about that you all, as representatives from ACS, could wish to share before we close the session? This has been a great learning opportunity. I can't tell you how much we appreciate it.
I would like to share one thing, because we are still all practicing a bit of social distancing and quarantining, but I want individuals and families here in Maine to know they're not alone. Even though they can't attend maybe their support group that they were so used to attending in person, the American Cancer Society is here to offer support and education. We have an 800 number at our National Cancer Information Center that is available 24 hours a day, 7 days a week.
Would you like to offer that number?
Sure, that number is 1-800-227-2345. And I recommend anybody to give us a call. We have trained cancer information specialists ready to talk through and answer those questions available.
Wow, that's a wonderful service. Yes. And Hillary, anything you would like to add? Again,
I would just say that, as Nicole said, even though COVID-19 has certainly made life more difficult for all of us, and people are dealing with social isolation, that the fight against, cancer doesn't stop because of COVID-19, and neither does the fight against cancer. And the American Cancer Society and ACS Canada and our staff and volunteers continue to fight really hard. And also, as you mentioned, we are a national organization, but we have a strong local presence as well. There's many staff here in the state of Maine, and I work really hard to represent the voice of cancer patients in the State House here in Maine and make sure that the laws and policies that we pass help in the fight against cancer. And I would just say, if more people want to learn about the organization or how to get involved, you can go to cancer.org, or for the advocacy side, it's www.fightcancer.org. And if you want to join us in calling on Congress to increase funding for breast cancer research and for those great prevention and early detection programs, you can text breast cancer to 40649. Again, text breast cancer to 40649.
Well, keep on pounding the pavement, Hillary. We need you. There needs to be more funding. So thank you both very, very much. You've been so helpful, and I know our community will benefit from the valuable information you shared with us this evening. Thank you so very much for joining us on LCTV.
Thank you for having us.
Thank you for having us.